So my name is Lorraine Johnson, and I'm with LymeDisease.org, and we have been advocating for patients for over 25 years. In LymeDisease.org, we do three things, and this is usually what advocacy organizations do. We advocate for patients, we're involved in research, and we're involved in education. One of the other things that we do is we've done large-scale petitions, but we've started moving into the arena of surveys because we're trying to put together information about Lyme disease patients. You know, it's a funny thing, but nobody's bothered to ask Lyme disease patients what's going on. So you have people saying things like, there are very few co-infections with Lyme disease. But if you go out and you ask patients who have chronic Lyme disease, you find that actually the incidence of co-infections is more than 50%. So this is just an example of the type of information that we compile. And this one shows how many people who have, you hear a lot of times that chronic Lyme is just the aches and pains of daily living. But this slide shows that it's not. It shows that a number of people are unable to work, and a lot of people have had to quit school, and people who are able to work have had to cut down their hours of work. And this is the type of information that when you meet with a healthcare policymaker, like a legislator, they really care about this, because that means that those people aren't contributing to the growth and well-being of their community in the sense of tax dollars. There's a large social cost to not treating Lyme disease. The IDSA has just recently announced that they're in the process of revising their guidelines. And the first thing that we looked at was, well, is this going to be a good, open, fair, transparent system where patients can actually have a voice or not? And we were disappointed that the IDSA has essentially chosen a number of members from their prior guidelines. They elected to exclude all ILADS treating physicians, and they even elected to exclude all moderate researchers. The patient that the IDSA selected was a token patient. They chose somebody who had not Lyme. And what's interesting is I serve on a national organization that has 40 different patient advocacy groups involved, and they do things like they recommend people to sit on guideline panels. So as it so happens, the IDSA contacted them and said, we need a patient representative in Lyme disease. And I'm the co-chair of this organization, and the woman who heads it said, well, I have just a person for you. And she mentioned my name, and they said, not her. And then she said, well, is there can she recommend somebody? And they said, no, we don't want a Lyme patient. So that's where we find ourselves today, in the situation where they're revising the guidelines that so critically affect everybody's life in this room. It affects whether you're going to get insurance reimbursement, whether you can be diagnosed, and whether you can be treated. And they've decided they're going to exclude all viewpoints that they don't agree with, and they're going to have a patient that knows nothing about Lyme. So when we contacted her to find out, well, what's your connection to Lyme disease? What do you know about it? And her answer was, I don't know anything about it. I've never had it. I've never known anybody who had it. And I don't have any knowledge of the condition. And she said, in fact, I think that's why the IDSA chose me. They wanted somebody who was impartial, somebody who would not be representative of the patient interests. So here we are at the very wrap-up. We have launched a survey that is intended to find out what patients think is important, because the IDSA has decided that the patient voice is not important. They put on their panel a patient who knows nothing about Lyme. They've excluded all opposing point of views. So this is an opportunity for patients to actually weigh in and say, here's what's important to me as a Lyme patient, and we're going to take that information and present it to the IDSA. We're going to use it with healthcare policymakers to let people know what it is that we fundamentally care about.